Hello, and welcome to our podcast through the University of Kansas Medical Center. My name is Angela Carrasco, and joining us today we have Lexi Oatman, a first-year Master's in Speech-Language Pathology student in the Intercampus Program in Communicative Disorders at the University of Kansas. Lexi, you have a plethora of helpful information to share with our prospective students, as well as some interesting facts that perhaps your classmates and faculty members do not know about you.
Yeah, thanks for having me today. I'm really excited to be here.
We are happy to have you. Thanks for joining us. Let's get started with some information to get to know you better. How did you become interested in the field of speech-language pathology?
So when I was younger, I was diagnosed actually with childhood apraxia of speech. And so I had to, originally they told me that I would not be able to speak, or they told my parents that I wouldn't be able to speak, that the only way that I would be able to communicate is through sign language. And so my mom kept going through trying to find different speech pathologists that would help us out. And eventually she found a speech pathologist that was really dedicated and set the goal that I would be, matched with my peers by kindergarten and be able to talk at the same rate that they do. And so through intensive therapy, that was able to happen. And so that just has always been my inspiration to go into this field.
That's interesting. Could you tell our listeners what verbal apraxia is?
Yeah, so it is a motor speech disorder where children have a difficult time kind of having their brain control their muscles to form the right speech sounds that they want to produce.
And that's amazing that a speech-language pathologist can help you with figuring out how to get past that obstacle and have a better outcome.
Yeah, it was a lot of intensive work, I remember, and I never wanted to go. I was kicking and screaming a lot and would always cry, but thankfully, like I said, the speech pathologist that we went to go see, she was really dedicated and really committed to reaching that goal.
Awesome. Where did you grow up, and where did you attend your undergraduate program?
So I was originally born in Wichita, Kansas, and then around the age of 6, we moved to Overland Park, and so I lived there for my entire life. And my dad went to KU, my older sister went to KU, so it was kind of a given that I was going to go to KU for my undergrad. So, been in Kansas my whole life and have been a Jayhawk ever since.
Wonderful. Yeah, it was kind of in your blood. You didn't have much of a choice, huh?
Yeah.
How did you conduct research into the graduate schools where you applied?
So the first step that I did was I pulled up the U.S. News ranking for speech-language pathology graduate schools. Going into my freshman year, I knew that grad schools were competitive, but I also had set the goal for myself that I really wanted to go to a top 10 master's program. Mm-hmm. So the news ranking website ranks all of the programs based on a lot of different things like praxis scores after graduation, the course rigor or difficulty, and sort of the amount of faculty that they have, things like that. Mm-hmm. So once I saw that list of the rankings, I then went to the American Speech and Hearing Association's EdFind, which is a tool that is for students to go on and look at different programs that each university has. And it shows things like the cost, the specialty areas that the faculty focuses in, how many people are accepted into each cohort, the amount of scholarships that they give out, things like that. And so kind of combining those two, I was able to make a spreadsheet of the universities that I was interested in.
You sound like a lot of our type A students that are very thorough in their research.
I get that a lot, yeah.
So what factors did you consider when selecting graduate school, since you had all of this research that you had accumulated?
So I had 3 sort of areas that I looked at when I was researching. The first was cost of the program and cost of living, because while I was interested in schools that were in California or in Boston, the cost of living in those areas is extremely high, or at least a lot higher than they were for my undergrad experience in Lawrence. So those were always hard for me to convince myself to go to. The second was the cost of the program. If it was really expensive out-of-state tuition, I had a hard time justifying it because I knew I was going to be paying for this on my own, and so I needed to find a smart way to, get the most for what I was paying for. Mm-hmm. The second area that I looked at was the faculty. So I tried to meet at least one faculty member from each program that I applied to, just to get a feel of the atmosphere and how they like to run things, ask them about their classes, things like that, just to see if, we'd be a good match. And then the third area that I looked at was areas of concentration. So going into grad school, I knew I was more so leaning towards speech sound disorders. That's kind of what I've been interested in since I started undergrad. But I wanted to go to a program that had a lot of different specializations and a lot of different faculty members that, could really go in depth on each of the kind of concentration areas of our field, because it is so big and there are so many different things that you could do for it. I really didn't want to go into my graduate program limiting myself, saying this is what I'm doing, I only want to go to a school that focuses on this, because that might change in a few years.
Right. And I know for the American Speech Language Hearing Association, they put standards out to say that they want students to have research or have those experiences in with adults and with children. And it's for that reason that a lot of students change their minds once they get into their graduate programs as to which population they want to work with.
Exactly. I've been back and forth so many times, and I think part of that is because at KU we do allow for so many different clinical experiences. And so that was something that I was really looking for. I wanted to make sure that I wasn't ruling anything out without trying it.
Well, you did some great research. I'm glad that you picked KU. And what actually made you decide to attend KU? Like, how did KU stand out?
The first one, I love KU. KU is great. Like I said, I went here, I've been coming here since the beginning of my undergrad, and it feels like home. I love Lawrence also. So I think the first main thing that I loved about KU was all the research opportunities that they provided. I did multiple research opportunities at KU during my undergrad experience, and for the graduate program, we're required to at least get 3 research credits during our master's program. I knew no matter what, I was going to have to do research. No matter what, KU is encouraging research all the time. And I also had the option to do my thesis. And so I think just having all these different opportunities to do research and work with so many different faculty members was really appealing. The second one was, like I had said earlier, my factors for picking a university was KU has such a wide diversity of different professors that specialize in different things. We have one of the greatest AAC labs in the country. I think it's amazing. We are really lucky to be able to help a lot of people with that.
But what's AAC?
AAC is augmentative and alternative communication. So it's just a device that helps people communicate electronically.
So if they're nonverbal?
Yes. If they're nonverbal, it's something to use to be able to get the message across.
Okay.
So that's something that's really unique about KU. But again, we have professors that specialize in a lot of different areas of this field, which was really important. The third thing is that we have 2 different campuses, which sometimes you think about it and you're like, whoa, that seems like a lot. But it's actually really unique because, like I said, I love Lawrence, but one of my things that was keeping me away from KU at first was I was like, oh, I've been at KU for 4 years. It's time to mix it up. But since it's on the Lawrence campus and at the KU Med campus in Kansas City, it's really different, and you're not feeling like you're doing the same thing every single day, and it's different experiences in terms of clinical work. You get the medical center side and the Lawrence Clinic, which is more of, you're seeing the same clients throughout the semester, and they're just very different campuses, which makes it really unique.
I always tell students that the campuses are so different in that the Lawrence campus is more of your organizations you can attend, the basketball games, all of the campus feel of going to a university, while the Med Center is more like it's connected to a hospital. It has all these clinics around. It's a medical feel. So they completely are different. Mm-hmm. You're right.
Yeah. And then my last thing that I really enjoyed about KU was the class size. I found on ASHA Find and the KU website that they really don't let in more than 30 students. That's like the max class size that they look for. That just seemed really nice to me because you get the chance to meet a lot of different people, but it's still a really good student to professor ratio. So I've gotten to know my professors really well because we're doing a lot more smaller group sessions. My clinical groups that I'm in are at the Med Center were no bigger than 3 people. So I really got to know my clinical supervisor and work really close with them.
Well, that's wonderful. If you wish to share, what type of funding have you received in your program?
So I work as a graduate research assistant in a lab here at KU, and that helps pay for my tuition and also helps provide me a stipend. And that has helped me pay for a lot of my graduate program.
What do you do as a graduate research assistant?
I am working in Dr. Holly Storkel's lab, which is the Word and Sound Learning Lab. And right now we are working on it's a project called the CAW Story Project. And what that does is It takes kindergarten-age children who have been diagnosed with a developmental language disorder, and we are working with them through a storybook intervention to see if exposing them to a specific vocabulary word and testing them on that vocabulary word a certain amount of times helps them learn that. Because studies show that children with a developmental language disorder need to be exposed to new words many times more than typically developing children that they can learn the word.
Wonderful. How did you find that GRA position?
Dr. Storkel posted an ad on the KU student work site, which is just on the KU website, originally for a student hourly position. And so I applied and accepted that position when I was an undergrad. And just since I was already in the lab and I had already been trained on what to do, they had an opening for a GRA position. And so I was sort of promoted up to that.
Great. How many hours a week do you work in that position?
So I do 20 hours a week, but that is flexible. I had the option when I started to either do 16 or 20. And I talked to some of the second-year GRAs who are in the lab, and they kind of reassured me that you could do 20 hours. It's okay. It's manageable. And so I decided to do the 20 hours a week.
And do you pick up any other gigs outside of the GRA position for extra money, or is that pretty much all you work?
Occasionally I will babysit during the week or on the weekends. I have a family that I babysat for all throughout undergrad, and so, I'll pop in now and then and help them out. And then I also help coach high school debate teams, and so I'll go on the weekends sometimes and help judge at tournaments or email kids about questions that they have to help them with that.
And that's why you're so well-spoken, Lexi. So from all of these experiences that you've had thus far in your graduate program, what was your favorite clinical experience that you've had, and why?
That's a hard one. They're all really, really great. I've been asked a lot by, family members and friends, especially around the holidays, what's it like at KU? What's your favorite one? And I really can't pick one. They're all just so amazing. So I guess I could start. When I was in my undergrad, I did a practicum at the Lawrence Clinic, and that was in the language acquisition preschool. And that one I really enjoyed because before that I was like, I'm only doing adults. Adults is my favorite thing. And then I worked with these little small kids that were all in preschool, and they were so fun to work with. And so that kind of swayed me. I was like, oh, maybe I could do kids. I could see that. And then when I got to the KU Med Center, when I started my graduate program, I was in 3 clinics. The first one was the ALS clinic, which is here at the Med Center, and you work on a multidiscipline team, which I thought was unique because it was the speech-language pathologists, it was the occupational therapist, the respiratory therapist, the neurologist, the physical therapist, the social worker. We all would sit together and rotate in and out of the patient's rooms and then come back together and table and talk about different things that we saw. And so I got to see 10 to 13 patients each week just in that clinic alone. And so that was a great clinical experience because no 2 patients are the same. So I got to see a really diverse group.
And interprofessional education is a big thing right now at KU.
Exactly, yeah. They say that a lot in class, and we learn about it a lot in class, but actually sitting there and being a part of it was really unique and an opportunity that I don't think you get at a lot of places.
Right.
And it really taught me, kind of what it's like to be working with a team. And you have another professional come in and they say, this person needs an SLP right now. And so you've got to, be able to talk with them and see what they think is wrong and then go in and get your findings and then go talk to the next professional that's going to go in. So that was really unique.
Wonderful.
The second clinic that I was in was the Pediatric treatment clinic. And so that was each week I had the same client. Both of my clients were under the age of 5, and they would come in, and for 30 minutes to an hour, we would just sit and work on speech sounds. And that one really tested my creativity because kids do not stay entertained for that long. And this one was different than what I had done in undergrad because it was just me and the child. It was just us in the room. And so I had to find games that were entertaining for them while still working on their speech sounds. I had to find ways, to keep them focused. And my supervisor for that was amazing and always had really great feedback, and would, anytime that I was struggling or she could see that, I didn't know what to do, she would, come right in and be able to help me and guide me. And I just think that was a really great hands-on learning experience. And then my third clinic was the Cleft, Palate, and Craniofacial Abnormalities clinic. And that one was really interesting because, again, that's just something I never really had gotten to talk about, were either of those abnormalities that could lead to a speech problem, or that's just something you never think of would need a speech language pathologist as an interventionist. And so getting to see the wide range of people, age range of people that came in was really interesting, and getting to help them. It's just something that I never really got to learn about in class. So getting the clinical experience of that was really unique.
And I think being at a university like this where you're in Kansas City, there's so much more diversity and so many more populations you can work with and so much more you can see. So that's nice to have all those experiences available to you.
Mm-hmm. And it's really cool, too, because Kansas is obviously more of a rural state. And so we would get people in all of those clinics from all across the state coming into Kansas City. You'd have people that say, oh, yeah, we drove in last night and it was a 5-hour drive. Right. And it's just a really rewarding thing to be able to know that you're helping these people have a better quality of life.
Absolutely. Have you had a faculty member or mentor that has really shaped you as a student, and why?
Yeah, so like I said, I came here when I was an undergrad, and my faculty advisor at that time was Dr. Holly Storkel. She was amazing. Like, we pointed out at the beginning, I'm very type A, and so she put up with me freshman year, emailing her hundreds of questions and being like, well, what if I want to do this in the program? What if I want to do this in the program? How do I do this? And she was always very responsive, never, told me to stop emailing her because I'm just a freshman and I need to calm down. Would always go over grad schools with me. So she was really great. And I also, my sophomore year of college, went through some personal things like a lot of people do. And I just was having a really hard time keeping up with my grades. And of course, in this program, or applying to your master's program, everyone always tells you it's so competitive. You have to keep your grades up. You have to stay on top of things. And so I was really stressing out because here I am kind of in this sophomore slump, and I was just thinking, what am I going to do? How am I going to, I can't apply after this. This is such an awful semester. And it was Dr. Storkel that kind of helped talk me through it and help me set up a plan that would get me through and how I would be able to come back for it. And I really think that's what helped me have a successful career as an undergrad in order to get into this program.
She is definitely amazing.
Mm-hmm.
So how do you relieve stress from school?
So there's lots of different things, and everyone's different. But for me, I think one of the things that helps me the most is there's a gym right down the street from my house where that offers lots of different classes, whether it's kickboxing or weightlifting or cycling. And so I'll go there with my friends and we'll work out for, that'll be our 1 hour break for the day. And so even if it's just that little time, as long as I can find that time in the day to space out and go do that, that helps relieve some of the stress. And I also love adult coloring books. That's something
Don't be ashamed.
Me and my roommates will sit on the couch and we'll color for, hours on end while we have Shark Tank playing. And that's kind of my de-stress of the day.
With Shark Tank playing, that's great. So between Kansas City and Lawrence, which restaurant is your favorite and why?
So I am a big breakfast person, and I will take this to my grave. I think Lawrence has the greatest breakfast restaurants of all time. And so probably my favorite in Lawrence would be the Roost. They just make the best pancakes, and they'll make homemade biscuits every morning that, they have like a rosemary chive one and a cherry chocolate. That one's my favorite, cherry chocolate biscuit. They're all just so delicious. And yeah, breakfast is my favorite, and I think Lawrence is the best breakfast place ever.
I may have to try that. Any podcasts or blogs or YouTube channels that you follow?
So I do listen to podcasts a lot because since it is an intercampus program, you're driving back and forth and you have some time to listen. And so I listen to The Daily and Pod Save America just to keep up on current events so I'm not having to read all the time. It's nice to get to listen to that. And then I also, for fun, listen to a podcast called Two Dope Queens. And that one's just talking about just the everyday struggles of being a woman and how women are also amazing and super cool.
That's great. That's good motivation for you.
Yeah.
Finally, any advice that you would offer prospective students? Think about this is the season right now where they've submitted their applications and they're waiting for their decisions.
Oh, I forgot how awful this time was. I remember this time last year. Yeah, I would say for people that have already submitted their application, it's in. There's nothing else you can do. So just enjoy the rest of your senior year until the decisions come out in April, because there's nothing else you can do to change that. So just go with it. For people that have not applied and are still waiting, kind of the opposite, do whatever you can. Join the club or reach out to your department to find out what kind of research you can get involved in, or what kind of clubs you can get involved in that are specific to the major. Just anything you can do to help out more is amazing. And any sort of professors that you can get to know better in terms of office hours or working in their labs, things like that. Just those are the sort of things that make you stand out on an application. And so being able to have those experiences also just really helps you once you get into graduate school.
You have given such excellent advice. Thank you so much for coming in today.
Yeah, thank you so much for having me.
We appreciate you taking the time to share your experiences at KU thus far. To our listeners, that was Lexi Oatman, first-year Master's in Speech-Language Pathology student in the Intercampus Program in Communicative Disorders at the University of Kansas. Thank you for listening, and rock chalk.